My first meeting with Spectrum Healthcare was one of an emergency, and it saved my life.
I had a cardiac arrest November 17th, 2009.
The doctor came down and said he needed to have open heart surgery. We were shocked.
By the time I got to the emergency room and was speaking with the ER doc, my heart stopped.
My brother called me to tell me Dad was in the hospital. We were all just thankful that he was able to get here and get the best care that he could.
As the family of the patient, you are so grateful to come in and see someone who you love be taken care of so well.
I would never wanted to go anywhere else. They brought me to the right place. They saved my life.
You have to have a vision of where you want to go, and our vision wasn't come to work and do the work we were doing before and go home. We wanted something more. The Institute is that vehicle, the Meijer Heart Center, that allows us to do that.
It's really a remarkable place to work. Many of the places around the country don't have the operating rooms and the equipment that we have. But more importantly, we have incredible nurses and physicians that work together and really are able to take great care of the patients here.
It is that collaborative effort and that multidisciplinary approach, along with education and research, that make an institute something more than just a hospital or just a heart center.
We deliver the best care now. I want to make sure that we are delivering the best care every year. This year, next year, 5 years down the road. Doing it better and better every step along the way.
This is about new treatments and new modalities and new problems that we want to approach. We want to be pioneers, leaders. We don't want to be just followers. This is the difference.
And the difference involves 1,000 steps of improvement. And each of those steps involves research. It's not that you get a better doctor or a better hospital. You really have a better way of doing things.
It just takes you to the next level in medicine, asking and trying to answer the questions rather than being satisfied with just implementing the care that you've been doing in the past.
I think this idea that research is different from clinical care is just not the case.
The research has become not so much a thing as what impact it can have on an individual. It gave us years, gave us time to be together.
When you see a walk and talk an example of output of that research, it's phenomenal.
Longer lives, better lives, healthier lives.
We don't want them to even think about their health. We want them to have it. If you look at cardiovascular disease, by far and away the #1 killer of Americans, men and women, young and old, athletes, non-athletes.
And it's the #1 killer of women.
Cardiovascular disease is probably facing all of us at some point in our lives.
This has become a community health issue. It's not just the care of this one person, it's the care of the community.
And through research, we can change the lives of these patients.
Somebody has to say that's important and improve where you were before.
I think it's gonna make the world a better place.
The research that we are doing and the support that we have from the community will change the lives of people for generations to come, not only in West Michigan, but across the world.
And it takes time, and it takes patience, and it takes finances. But we have to take that road.
In the end, the amount of research that's necessary for things to move forward relies on donorship, partnership, investment.
Giving money to cardiovascular medicine is going to help your family, you, the community,
And I think that's where we as the public have an opportunity to make a difference.
If it can save lives, add to the quality of life, I think it's well worth the investment.